Hi again, everybody. This is Dr. Tim Newton with Inspire Movement Physical Therapy. In this video, we're going to show you some strategies that you can utilize to help you alleviate low back pain. If you're experiencing bad low back pain, our first and primary goal is to alleviate that pain. Right? It sounds obvious, but we're trying to stay out of painful and provocative positions and activities. So if it hurts, don't do it. You may have already started physical therapy. You may have tried ice or heat. Those are all great. I would also encourage you to focus on your sitting posture. We've got a video on that on our website. And also look into the pelvic clock exercise. Also, we have a video of that. Those can be helpful in getting you on the right track to getting the pain to go down. Here we're going to show you a couple of things that you can do position-wise to just try to find a decompressing position of ease and get that pain to go down. So one that we're going to start with is actually on our stomach. So go ahead and turn over. The reason we do this is because we're actually putting the spine in the opposite position of what it normally has to deal with day to day. All day long we're sitting and slumping. When we're bent forward in a slump, that compresses the discs between the vertebrae of the spine. And sitting, of course, has gravity driving its force down into that spine. So this is difficult for those discs. By lying on your stomach, you're now taking gravity out of the equation, and you also have your normal backward arch in the low back, right? So that is the opposite of slouching. So just by getting in this position, you are taking pressure off of the discs of your back, and this can be helpful for a lot of people. You may even notice more benefit if you take it a little bit further. So what she can also do is prop up onto her elbows to accentuate that backward arch and further decompress the discs in her low back. And if she wants to come up even farther, if she just can't get enough of it, she can bring her elbows in a little bit closer toward her hips, and that will further arch her low back. Now, if you're doing this, you can do it for as long as you want. Don't go too far with it. You may find a happy medium where if you go too far, it hurts a little bit, but if you're down a little bit, it feels best. Find the position that works best for you. Our goal here is to drive pain away by staying away from it. We're talking about not aggravating things, not flaring things up. All right? So this is one position that many of you can try. When you're in this position, whether you're up on your elbows or sort of down, chin to your hands, you may even tinker with it and walk your shoulders one way or the other. So you can move your elbows, move the elbows a little bit, both elbows, move both elbows to either the right or the left together. So she's going to take her right elbow and her left elbow and take them both toward the right. She's going to relax everything here. So she's got a right side bend, and then she's going to walk the elbows over to the left side. And now she has a slight left side bend with her spine arching backward. Okay? So this is just a way where you can even try to bias your spine one way or the other. You may find extra relief in those positions. Okay? You don't have to do it. It's just an option. So you can get up in a straight prop. You can hold for 20, 30 seconds. You can hold for 5 minutes. You can get up and kind of bias yourself to one side and hold there for 5 minutes. It's up to you. Find what works for you. Your goal now is to get pain to go away. All right? Then another position that works really well is on your back. So go ahead and flip over onto your back. And this is very easy. You lie on your back and you prop the legs up. So she is here in this position. By having the legs resting up on the chair, she's taking weight and tension out of her hips and her low back, and she can rest here. Now, one other good thing about this position is that she can combine other remedies with it. For those of you who did watch that pelvic clock video, she can do pelvic clock tilts in this position, okay? She can also put a hot pack or an ice pack underneath her low back if that's where it's bothering her. So she can combine things here. And this is just a good general position for most people that helps decompress that lumbar spine. Some of you will not get relief in these positions. You may have stenosis, where arching the low back bothers it a little bit. So, if you're one of those people, you want to round your low back. So for that scenario, you would want to hug a knee or maybe two knees to the chest. And what this does is it rounds out the low back and decompresses things a little bit differently. In this case, if you are a disc person and you don't want to compress the disc, this may bother you. But again, at the end of the day, just listen to what the body tells you to do. You may find only one of these three positions helpful. You may find all three of them helpful. The goal, again, is just to listen to the body, get pain to go down. And from there, you try to just build this into the routine. And on the other side, you're avoiding the aggravating factors, and your body should start moving in the right direction. Those are some of the things that you can do to start trying to drive down the pain in the low back. If you found this video helpful, leave us your comments, your questions, subscribe, and give us a like. And don't forget to check out our website for more related material at MarylandManualTherapy.com. Thank you for watching, and have an inspired day.